So if we're thinking about a left sacral flexion and we're wanting to approach it with Still-Laughlin functional technique, and we're going to do it from the seated position, the most important thing is remembering our axes that we've talked about. So the best way to get to the PSIS, which is where you're going to feel your axes, so if you just palpate and get at the top of the iliac crest and make your hands perpendicular, and then if you just drop your thumbs down, then you'll be almost on the PSISs or right at them, and then you can just fine tune it. So remember, the middle transverse axis is what your sacrum works on, and that is at the level of the PSIS. Your superior transverse axis is 1 finger's breadth above, and the inferior transverse axis is 1 finger's breadth below. So at the level of the PSISs, if you just take and gently translate your patient back and forth, you want to be at the point that all the motion is localized right at your fingers. And if it's hard to translate the patient, you can always ask permission, and you can use your head as a third hand and put it into the back to help you. So that is an option too. So, and it might be kind of hard to see, but right here I have all the motion localized right to the middle transverse axis, which is the axis the sacrum works on. And with the left sacral flexion, we don't have a torsion. So at the middle transverse axis, what we want to do is we're setting this up. It's an indirect technique. So we're going to be on the middle axis, and at the left side is the dysfunctional side. So we want to always want to monitor the dysfunctional area that we're treating. So my hand's going to come up here and get on the shoulder. So we have to ask ourselves, which way is the sacrum working? Which side is the functional side? So if we imagine the sacrum having eyes in the front of it and we're looking from behind, in a left sacral flexion, the sacrum is going to be looking to the right. So if the sacrum is looking to the right, we want to load the right ischial tuberosity, because that's going to load the patient to the ground, the patient to the table, and it's also going to lock up all of this side because we want to localize our motion here. So if I get back on my middle transverse axis, okay, so now as you can see, if I come here, look, there's less motion going on. So that would be the superior, and then here, even just the whole body will move much better. The sacrum is going to move much better there versus if I come down here, then because I'm on the innominate axis. So at the middle transverse axis, then we want to load the way the sacrum's looking. So with the left sacral flexion, we're going to, by load, we're just going to side bend just till we feel that ischial tuberosity load down to the table. So then we've kind of loaded, we've locked things up, and you can see that. But now we have to loose pack or float the dysfunctional side. So load it down, we got just a little bit of compression holding that there. But if we just back up the least bit right there, and you hopefully can still see how much motion is right on. So we're still loaded on the right, but we've optimized the movement at this dysfunctional joint here on the left. Now you're going to add an activating vector force, and so you want to imagine trying to get your hands to touch. So you're going to load a force coming straight down through here. At the same time, you've blended in through here, through your thumb at the dysfunctional joint. So you're just going to continue to load compression in that angle. And then when you feel the tissues soften and start to activate, you're going to maintain that. Don't back up. That's the biggest mistake people make. Is as soon as things start moving, they let off the tension. You want to maintain the tension. And the body, most of the time, it's going to go more into what it likes to do. And then it'll reach a little still point. And that still point, which is happening right now, don't let off your tension, maintain it. And then all of a sudden, the body will open up and it'll go around into what it can do. So, and it's that simple. But it's your palpatory skills and stacking your loading and your floating and being on the correct axis that makes all the difference. If you're loading and you feel like, and the body is dancing like this, most of the time that means that you don't have enough vector force added in, or you don't have your localization. The movement should be slow, succinct, and you should be able to reach maximal treatment within 30 seconds or less.